women will tell you they hate that time of the month where they feel bloated, anxious, depressed, you name it. It's all related to premenstrual syndrome. Dr. Clark Hansen is here to tell us what we can do to minimize these awful monthly side effects. And, you know, anybody will tell you, I'm sure you women complain all the time, and we just think it's normal.
Most women just think everybody has these, and I just got to fight through it, no pun intended. You feel like fighting, obviously. You're irritable, intense. Most women know the symptoms. 40 million women have this PMS every month, and sometimes it's 2 weeks. So it's like you feel like you have this for half your cycle, and then you have the menstrual period. It's like you're always battling this.
And I was surprised when you said, no, it doesn't have to be that way. I just assumed that's just the way it is, you know. You just think that that's how it's supposed to be.
Well, we need to change that because it's not just a little annoyance. It really is a serious problem. So let's talk about the symptoms.
Yes.
Just kind of run through the symptoms because most women know them, but there's mood symptoms and then there's physical symptoms.
Okay, so the mood one I think we can all relate to
those.
And it seems like they get worse as you get older. The irritability, the tension,
anxiety, depression, and you just kind of expect this every month, or sometimes it's just broadsides you. You're just surprised by it, but tearfulness or oversensitivity, it's exaggerated mood. And then there's the physical symptoms that go along with those as well, which fatigue, bloating, weight gain. Women hate that, of course. Breast tenderness, swelling of the breast, and then acne, sleep disturbances, food cravings. Yesterday I had a patient come in, 32 years old, who has a 3-year-old boy and a 1-year-old daughter, and she's got PMS that's just destroying her life. And it's just after 2 children, you'd think, okay, maybe I'd be balanced out, but we have this problem in our society with this imbalance of our hormones. And why does everybody have it? Why is it getting so much worse? She has acne for 2 weeks. It just comes on suddenly. She's fatigued, she's depressed, she's irritable, and she's lightheaded. So how is this happening? And now after a few months, all those symptoms are gone because we balanced her hormones.
So is that the cause, the imbalance of your hormones?
Yeah, the cause is this disruption of the hormones. It's an imbalance. We're supposed to keep estrogen and progesterone at a good balance. Progesterone helps to kind of suppress the side effects of estrogen. You got to have estrogen for the first half of the cycle.
Well, let's take a look at a graphic that you brought to. This is kind of, it better explain what happens. Okay.
So there's several hormones that are involved, and the one in the middle you'll see estrogen and progesterone. So estrogen is that red line that goes up and causes a woman to ovulate. Right at mid-cycle it goes up, then it's supposed to go down, and progesterone is supposed to go up the second half. Now estrogen stimulates proliferation of cells. So that means increasing numbers of cells, and that prepares the uterus for having a baby. And if you have too much of that, it causes all kinds of damage, including uterine fibroids, endometriosis, and PMS, because that causes a lot of those hormonal changes that lead to the acne, that leads to the cramping, because you've got just too much of that intensity right there going on.
So we're getting too much estrogen and not enough of the progesterone, which if you had a healthy system, they would work together.
Right, and progesterone helps to turn off estrogen. It actually activates tumor suppressor protein.
I see.
So it actually suppresses cancer. So too much estrogen will cause cancer, breast cancer, ovarian cancer, uterine cancer, and even prostate cancer.
And you were saying the same with men. They're not getting enough of the progesterone as well.
The women watching need to know that their husbands are at risk because of estrogens that they get in the environment. So when we talk about the cause, why is it so prevalent in our society today? It's actually new since the industrialized revolution. Modern society, this is a side effect of manufacturing and modernization, industrialization. And I brought some things here. What do they have in common? These all have estrogens in them.
The plastic, is it the plastic?
Well, it's the plastic. All these bottles are PET plastic, polyethylene terephtalates. That's why we call it PET.
It's a mouthful. And Donald's getting kind of a zoom in there, and you could see those little labels.
Yeah, on the vitamin water. Even in vitamin water we think is healthy. It's got this recycle 1 on it. That's a PETE. That's that polyethylene terephthalate. Those phthalates actually carcinogens. They disrupt the endocrine system. They stimulate estrogen receptors, and progesterone is supposed to help turn that down, but we're bombarded by it.
Sure.
And not only in the plastics, but in meat, beef. It's what's for dinner is the advertising slogan, and we eat too much of it, and we actually feed these beef cows and dairy cows estrogens because that makes them put on weight faster, gets them to
Sure.
market faster.
Sure.
So we just got way too much.
And that's what we were talking about earlier, that, you know, you're giving your kids all this stuff, and we're seeing more. Is it true that more and more of our kids are maturing or
Yes.
developing quicker because of all this?
Menses used to start about age 16, now starting at age 10. And younger.
Absolutely.
And girls are developing sooner, and so PMS in a woman or in her daughter needs to be treated, because it's not just a little annoyance, it leads to breast cancer.
Right, it's a
And in
bigger
men,
picture.
Even these plastics, men drinking these drinks, now for example, water only has 3 micrograms of the phthalates per liter.
Right.
But a soda has 1,000
Wow.
phthalates.
Well, you were talking
per
about
liter.
hormones. It's the only way to regulate it. And what's the difference between synthetic and natural? I think people are still confused about that.
So the natural works with the body.
Right.
The synthetics, and this one reasons they haven't been able to figure this out in the past is because prescribing synthetic progesterone hasn't cured the problem, because it doesn't actually work on the progesterone receptors in the body. The synthetics aren't made for the body. They are foreign to nature. So the natural ones that come from the wild yam, or the ones the body makes inherently, and the body makes it in the adrenal glands as well in the ovaries, so men make some as well and need it. And the natural one does stimulate the progesterone receptors, and should be 100 times more progesterone than estrogen. And a woman's level starts to decline at age 35, and a man's will decrease at age 45. And we just don't have enough to combat all the things that we're being bombarded with.
Right.
And the progesterone helps to calm the nervous system. We're actually finding now it can be used to regenerate brain trauma. So brain trauma patients can take progesterone and actually reverse that, and helps the memory, helps the mood, helps improve sleep. So all those side effects of what we think of as PMS, just an imbalance of estrogen and progesterone.
And Dr. Hansen was saying earlier that a saliva test is truly the best way to see where your hormones at. I know you'll do that as well for people.
Women just got to test and find out what their levels are, and then we know how much to give. And we give this product here. Is a sublingual natural progesterone in these little tablets you put under your tongue, so it gets right into the bloodstream. And that's made from the wild yam, the Dioscorea, alfalfa, hawthorn.
So it's safe and effective.
Safe and effective. It's just amazing. The women come back in a few months and all their symptoms are gone. They're feeling great.
See,
they're
you don't
sleeping,
have to live
their
with
energy.
it. Who would have thought?
Yeah, don't live
Who
with
would
it.
have thought? You don't have to. Now, you have a special offer we want to let folks know about
Yeah.
who want to kind of combat this and get over
We
it.
want people to call and find out more. So
Okay.
call and schedule an appointment, and we'll give a gift certificate that's worth $50 to the first 15 callers who call and schedule an appointment.
All right. Best place to start is to find out where your levels are. It may surprise you.
Yeah, get tested. We use a saliva hormone test, and you'll find out, and you'll know where you are.
All right. And you're going to be coming back again, right?
Yeah.
And we'll be
We're gonna
talking
talk about HPV, human papillomavirus.
Okay.
Don't give your daughters the Gardasil vaccine. There's a natural cure.
All right, oh boy, he's got us standing by for that one. Thank you, Dr. Hansen. Really good information. And if you do want more, of course, you can visit Dr. Hansen at the Hansen Clinic of Natural Medicine at drhansen.com, or there is the phone number right there on your screen.